Racemic Epinephrine. Common trade name might be micronephrine. You might see it that way. It is a sympathomimetic. Mechanism of action: it is a beta-2 agonist causing bronchial smooth muscle relaxation. It also inhibits histamine release, and it has a smaller amount of alpha and beta-1 effects. It is a different makeup. There's a different not concentration, but it is a different genetic makeup than regular epinephrine. You can't just use one or the other. They're different. I'm struggling for the word, but they're not the same. But it does have some alpha and beta-1 effects, just not as much as regular epinephrine. It is pregnancy class C. Indications for it: asthma attack, croup, laryngeal edema. We're going to use it pretty much solely in kids for those indications. Contraindications: hypertension, underlying cardiac disease, and epiglottitis. Some adverse reactions we want to be watching for: anxiety, headaches, tremors, nausea, vomiting, tachycardia, dysrhythmias, respiratory weakness, all those good ones. Drug interactions: MAOIs and beryllium may potentiate the effects of racemic epi, and beta blockers may blunt the effects, just like with regular epi. It's a beta agonist, so beta blockers can blunt those effects. For adults, dosing not commonly used. For the kids, less than 4 years of age, we're going to give 0.25 milliliters of a 2.25% solution, diluted down in 3 milliliters of normal saline, and then we nebulize that with oxygen, usually like 8 liters per minute, something like that. Greater than 4 years of age, we just double that dose. We're going to give 0.5 milliliters of the 2.25% solution, dilute it down with 3 milliliters of normal saline, and then nebulize that as well. Onset: less than 5 minutes. Peak effects: 5 to 15 minutes, something like that, and then it'll stay in the system for 1 to 3 hours, depending on the person. The thing to watch for with it is it can have strong rebound effects after administration. So you want to make sure you're getting to other medications on board that can prevent worsening conditions after this is done. So it can cause those rebound effects. You want to watch for that. Excessive use also may cause bronchospasms. So that's why I want to just give one dosage, and hopefully you don't have to worry about that. But keep in mind, they are structurally different, epi and racemic epi, so you can't just substitute one for the other.